everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this episode I'm going to teach you how to perform massage when you have cording. So if you enjoy this content and you would like to see more, then please give this video a big thumbs up, subscribe to my channel, which is completely free. You can unsubscribe at any time, and leave a comment in the section below if you have any questions on how to perform massage with cording, any questions around cording at all, or any other questions around breast cancer in general. So without further ado, let's get into this video, how to perform massage for cording. So first of all, let's just talking about what cording is. I'm going to give you guys a quick recap on cording because I have actually done a couple of other videos before on the topic of cording if you've been following my channel for a little while. And I'll put links to these videos in the description bar below, but probably the best first video to go and have a look at would be this video, which is how to resolve cording after breast cancer. That video goes into quite a lot of detail about a technique called neural mobilization stretching. And as far as treating cording goes, you don't want to rely just on one thing. So you typically always treat cording with a little bit of massage plus neural mobilization stretches. And the good news is, guys, that as a patient, you can do both of those to yourself. So in this video, we're going to go into the massage side of treatment, whereas the other videos I've done are talking about neural flossing exercises or neural stretching exercises. So I'll leave a link below so you can check those videos out when you've got time. Okay, so as far as cording goes, there's actually no medical definition as to what cording is, but from all of my clinical experience with cording, I can't see why it isn't what I think it is, which is nerve tension. Now, how does cording present when it does come up? You'll tend to lift your arm up and you'll notice, if you can see it, a strong cord-like structure. Typically it's under the arm, but it doesn't always have to be there. Sometimes people will have cording around their elbow, and I've even had circumstances where people have had cording into the breast if they've had a lumpectomy, chest wall, around the base of the breast. So because nerve tissue is everywhere, you could technically get cording in a lot of different areas. It's just that with breast cancer patients, cording typically tends to be either in the armpit, the arm, or around the breast or the chest wall. So that's what cording tends to look like. When does it present? Typically after breast cancer surgery. So I don't often see it come up if you've, say, just had radiation, or you're going towards the end of chemotherapy, or you're 6 months out after treatment. Most typically cording will present when you have just had breast cancer surgery in those first couple of weeks. Now, the interesting thing is that cording, I don't think has got actually anything to do with whether you've had a lumpectomy or a mastectomy per se. It's everything to do with how much the surgeon has to muck around in the axilla with assessing lymph nodes, taking lymph nodes out, and generally just moving around in that area because there's a ton of nerve tissue that sits in this region. So, the reason I can say that, of course, is because I've seen other patients who've had cording who are not patients who are going through breast cancer. We have some rare circumstances where, say, I've had patients who've had like a cyst in their armpit removed and they've got cording just from all of that mucking around in the armpit region. Okay, so like I said before, what is cording? It is nerve tension, but the first thing I want to talk about when it comes to resolving nerve tension is what sort of pressures can we use when we're performing massage on tight nerves. And by tight nerves, I'm literally talking about the cording. I think one of the biggest issues I see for people who go through breast cancer is that if there's anything they are supposed to be massaging, they're really unsure as to how much pressure they can put into it because they're often worried that if they put too much pressure and it hurts, that they're damaging themselves or they're going to do something that's really not good. What's often surprising to my patients is that when they come in and they actually start getting treatment for things like cording or tight scar tissue or radiation fibrosis scarring or even just a tight shoulder after surgery, they are quite surprised sometimes at how much pressure is not only safe but has to be done to be effective. So let me reassure you right from the get-go that if you are massaging cording, it is safe and way more effective to be firm, because the other end of the scale is if you go too lightly, you may not ever break up that tight tissue. So firm is safe, and firm is more effective. Let's talk about direction of massage. So ideally we would like the massage to be performed in the direction that you're pushing back towards the armpit. So if you've got cording in your elbow or in your armpit or this general upper arm region, in general, we would suggest that you go towards the armpit. That's obviously got advice around it in regards to lymphedema. So if you're at risk of lymphedema and there is some excess lymphatic fluid sitting in your arm, or if you have lymphedema existing already and you get cording, then in an ideal world, we really do want you to push that fluid or break up the cording, shall we say, but pushing the excess lymphatic fluid towards your armpit, because this is the most effective drainage point for lymphatic fluid if there's any lymphatic fluid sitting on your arm. If you've got cording in your chest wall or your breast, ideally we would again probably drain towards the armpit. When you've had lymph nodes removed, interestingly, and you've had a lumpectomy, the lymphatic drainage pathways of the breast actually change. So technically, if you've got cording through your breast tissue, you could push the direction of your massage towards the inside of your body. So literally meaning towards your sternum or your breastbone and up towards your collarbone. However, at the end of the day, the purpose of the video is to talk about breaking up cording. So when we're trying to break up a cord, we have to be treating the cord itself. So technically speaking, yes, we can apply direction to this massage, but I'm actually more interested in getting the cords to break up, because cording is something that you can resolve in the majority of cases. So I'm not too worried if you're doing a direction, particularly if it's on the chest wall, that's not necessarily towards the armpit. I would rather you break up the cord and then you can get on with any lymphatic drainage massage if you need to perform it. Let's talk about frequency of massage. I really stress to my patients, guys, that I don't really want people doing this type of massage more than once a day, because if you're doing it more than once a day and for more than about 5 to 10 minutes as an absolute maximum, you could actually make yourself too sore. So sticking to probably between 5, maximum 10 minutes a day, once a day, to work on the frequency of this massage, then that's usually safe and effective. Let's just quickly talk about what creams I tend to advise for massaging cords. So obviously using a cream is a very sensible idea, because you really have to get into the cords quite firmly to break them up effectively. So rather than not use a cream and pull and drag on the skin, I would definitely recommend using a cream as a lubricant to do this massage. I typically would use either something like Sorboline, Mugu or QV cream. But at the end of the day, anything that's not irritable to your skin and is a low pH water-based moisturizer is probably ideal for when you're performing massage to cording. Just a couple of little warnings, guys. When it comes to treating cording, I want to tell you 2 things. Firstly, if you hear a noise, click, pop when you are working on your cording, that is fantastic. A lot of people will hear a noise or feel a noise when they are treating their cording and they will freak out, and that's a little bit understandable in the context of having had breast cancer, because you do get quite anxious when your body does funny things when you're treating something as unique as a cord. But if you get a snap, crackle or pop, so to speak, then that's actually a good thing. I believe that is the cording releasing and letting go. Most of the time when people hear a noise when they are performing massage or they're doing neuromobilization exercises and they hear something go, they'll actually, even if they get a bit worried at first, they'll actually go, oh, that feels a bit freer now, I can move a little bit more. And it's not unusual for me to be massaging cording and to actually feel the popping happening. And that's something I reassure my patients on all the time, that this is good, it's breaking up, it's what it should be doing. It's a little bit like cracking your knuckles. Cracking your knuckles is actually carbon dioxide bubbles popping around the joint. It's not bones moving back into place or anything as crazy as that. They've done CT studies on this and proven that the cracking of joints is actually just carbon dioxide bubbles popping. My belief is that when there's noises going off when cording's letting go, I'd suspect it's the same sort of thing. It's just that release of tension. The other thing I wanted to warn you guys about with cording is that from what I've seen, there's usually not necessarily one magic bullet to resolve cording. Usually it takes a little bit of massage as well as neural mobilization exercises. So if you've got cording and for whatever reason, you're only doing massage, you might need to add in neural mobilization exercises and vice versa. So I would always recommend doing both. There are occasions where people can just get away with neural mobilization exercises and not doing the massage. But particularly if your cording gets a little bit stubborn, it's a good idea to do both the neural mobilization exercises and the massage. Thank you so much for watching, guys. I really hope you've enjoyed this video and gained some great information. If you'd like any further information on cording, on stubborn cording, on neural mobilization exercises, check out my other videos, but also leave a comment in the section below if you want me to tell you more. Look out for my next video coming out next Tuesday. I hope you're having a great week wherever you are. I'm Jen McKenzie, the Breast Cancer Physio, and I will see you next time.